Thank you for listening to this episode. We greatly appreciate your support. We would greatly appreciate a positive thumbs up on all of the platforms like iTunes and Spotify or wherever you're listening. And we just thank you for our Patreon supporters. We greatly appreciate your help in getting this message out. We think there's a lot of important information, and hopefully this helps you. Have a great day, and thank you for listening, and thank you for your support. Hello and welcome back to the Life's Best Medicine podcast. This is fun for me. I have someone who's actually been a great support of mine, like getting started with direct primary care, changing my life from killing myself every day in a 16-hour day, 14-hour day job to something I really love, and giving me the courage and the encouragement, and saying, hey, look, here's what I'm doing. So Molly Rutherford, welcome, Doc. Great to have you.
Thank you. Good to see you.
I love what you're
Brian.
doing. You're doing really great areas of like addiction medicine. Maybe tell people about what you're doing with direct primary care and how you got into that, and how you wrote me into this lifestyle and all that kind of stuff.
Okay, sure. I'm happy to. So I started in direct primary care very similar to what most people, the stories are similar in that most of us were working in the traditional system, working for a hospital system as an employee, for example, or, some of us had a private practice and just couldn't stay open because of the overhead. And so we ended up in this direct care model where we just eliminate the insurance middleman and the government. And I decided to do it back in 2014. And part of the reason I decided to do it was because of my addiction medicine experience. So I was working for a cash only addiction medicine practice that had several offices in Kentucky. And I noticed while I was practicing that I had as much time as I needed to spend with the patient. At that time, substance use disorders were not really covered by insurance, and they weren't covered by Medicaid. So we didn't have to worry so much about coding things correctly, how much we were going to be reimbursed for it. So it was very enjoyable. I loved it. And along with that, just treating addiction is so rewarding. And because what we do in the low carb space is very similar to treating addiction, because we are helping people change behaviors. And for some people who struggle with their weight, it goes back to food addiction. So you know what I'm talking about, how rewarding it can be when you see someone have success and completely change their life around. So that's kind of how it got started. And the same year I started the practice, I was baptized. I had started going to a new church a couple of years before that. I was raised Episcopalian, so I was baptized as a child, but we weren't really active in church when I was growing up. And when Chris and I got married, we decided we wanted to raise our kids in a church and expose them to Christianity, to our faith. So I don't know, I just went for it because I felt like I couldn't start my own practice and take this huge risk without God's help.
Yeah, trust me, I know that, because I was, really, when I left my old practice, I had financial security the rest of my life. I had earned my keep. I had built my reputation, right? All those things were happening, and I decided, it was one thing after another. I think the Lord led me down this path to say, but if I didn't have the Lord, I don't know. Faith was like a huge, it's funny. My wife and I laugh about it. I go, I feel like I should go down this path. I don't know why, but I should just do this. And she's like, okay, do it. Right. And then it all opened doors and doors, and crazy stuff happens. And all of a sudden here I am doing a podcast with Tro, and, being blessed, and then coming over here, and then, all these crazy, I can't explain it logically how all these doors open, and, things fall into my lap, and I learn stuff, and I cross paths with people, and
Yes.
Tro obviously had a huge influence on me, and so there's so many, Dr. Horvitz, just saying, hey, look, you can do it. And I think that's the big thing too, faith, and also someone believing in you, as far as addiction or weight loss or whatever. So, hey, I'm in your corner. Let's do this thing. We got it. And like when you and other people say, I got your back, Brian, what do you need? Let me help you. Let me show you what I had to do. And you helped us so much behind the scenes, and people just don't realize that. But faith is a huge, huge thing when you're taking that huge jump into the
Yes.
darkness, you know?
Well, and my life has kind of always been similar to what you're saying. I feel like doors were open that we all try to plan our lives. We have these plans for our lives, right? And then all of a sudden you're sitting somewhere else and somebody asks you, well, like for me, for example, people always say, well, how did you end up in Kentucky? And I don't really have a good explanation for that, because I grew up in Virginia and I really thought that I would always live in Virginia. But I think God brought me here because I think, I was meant to help people that struggle with addiction. And even though if you had asked me that while I was in residency, hey, do you want to specialize in addiction medicine? I would have thought you were insane. Like, no, I don't want to deal with that. That is so frustrating. But
yeah, it's a calling. It's a hard thing because for me, it's like, there's so much, the failure rate is so high and there's so many people who struggle. And I think people just, part of the failure rate, I think, is because we're not handling it the right way. We don't understand, food addiction and how that contributes, and other addictions, pornography, whatever it may be, how that affects drug use and alcohol abuse and just escapism, trying to get away from bad stuff. And you could probably tell me, this whole COVID lockdown thing really affected people. I saw more addiction, more depression, anxiety, spousal abuse, child abuse, all those things that we were seeing on the front lines. And it's overwhelming to realize how much of being isolated affects those things.
It's terrible. It's been really interesting. The past year has been so interesting to see where people sort of fall on their opinions regarding COVID and what we should have done and lockdowns. I feel like from the beginning, I'm like I said, like I said before we started recording, I'm so thankful for Ivor because I was with him the entire time. I mean, when my husband called me and said the NBA they just walked off the court because I was just like, that. What? That's insane. And then when they started shutting things down, I was still just in my mind, I was kind of like, oh, okay, I guess it's going to be really bad. But I was still in my mind going, this doesn't make any sense. Because I had looked at the, Diamond Princess. I'd looked at some things. I don't know. I was incredulous the entire time. And
it's a hard thing. It's a hard thing too, because for me too, I was looking at data and I was like scratching my head saying, am I the only one this doesn't make sense to? Like, because I've seen the mass data, I've seen a lot of the data, but if you say anything, you were called irresponsible, and it's a hard thing, especially when you're. And then
I worked for Fauci. I think I told you that. Like so then there was this part of me who has this kind of respect for Dr. Fauci from when I worked with him. And so, early on, if you look back at, my social media, it will say, I trust this man. Like I never got a partisan vibe from him. I mean, I really didn't, but I was also, very young and was working for the NIH during the Clinton administration. So, it was a different atmosphere. It wasn't like the whole charged, the whole divisive nature of the Trump administration. So it was a different time, but I really did trust him. And then what happened in March was early April. One of my patient's sons, he was supposed to have a court date, and he for a drug related charge, and it was canceled, because they closed down court, they closed down everything. And he ended up overdosing and dying, so he may have ended up overdosing and dying eventually. Who knows? But it was very clearly tied to this fact that if he had gone to his court date, maybe he would have been able to get some help. Maybe he would have been sent to treatment. Maybe he would have been in jail. Maybe this, 19-year-old young man would still be alive. So that was when I started to kind of just get disgusted and think, do they not think this is going to have other, ramifications? And then there were two more ex-patients. They weren't with me anymore, but who overdosed over this past year. One of them, I went to the funeral. They were only allowed to invite 25 people, and I'm honored that his mom wanted me to come. But it was just one thing after another, and so it was all during this time, I had my faith, and so I was still reading my Bible, but my church was closed, and we could watch it online. Well, I can't do that. I just, it wasn't, I can't pay attention.
That's an important point. I think the sense of community. As a matter of fact, I went out to dinner with my wife last night, and this waitress we'd been seeing, we'd go and, we'd have to wear masks and all this stuff, but we had never really seen each other's face. We've interacted, but like to see someone smile, it made such a bonding time. And it's like everyone's so happy to connect. And in a church community, it's extreme. People listening will understand what I'm saying. Even in the low carb community, when you're separated, the last person I probably hugged was Ivor Cummins, right? Because, we were together in Denver when they shut down the conference and we all took off, and we didn't know the gravity of what was happening at that time. And, it was one of those, like, discussing some things with him and about medicine, his integrity. And that's one of the I was teasing him. I said, the disadvantage is I know you and I know your integrity. And so it's a problem when he came out strong. And a lot of people in the low carb community said, this guy's he's off his rocker. He's crazy. Look at him. He's going against what everyone's saying. And you realize that, but what he's saying is true.
And what is the motive for being dishonest about? What is the motive for those of us who think the lockdowns are harmful, or who know the lockdowns are harmful now, and who are willing to try, very inexpensive medications on people with COVID? What is
not only inexpensive, but also used for 65 years that we knew the safety data on? It's not a new drug that we haven't experimented on. And the same people who criticize that were the first ones to say, give everyone the vaccination right now before we even, and so those of us who said, well, maybe we should study this a little more and make sure it's safe, and make sure, just
right.
Let's look at the risk and benefits of all these things. And that's our job as physicians, is to weigh those things, not to give our opinion necessarily, but to say, let me look at all the data. Let me look at the studies on masking, not what the social media, not what the media says, but what do the studies show? And what does our clinical experience show? What is my experience in all the hospitals? And what's my experience with a natural immunity after an infection? All these things that no one really talked about. And you say, well, what about this? And they say, well, you're crazy if you talk about it.
And what about logic? Like, why can't we use logic? I understand the evidence-based medicine push, but
fear takes away logic. That's why fear, when you're fearful and you think I could die from this thing, it really makes you say, okay, I'm not going to take any chances at all. I'm going to be better to be safe than sorry. Right. That's how we all reasonably so at the beginning said, okay, let's be really safe. And then when they said 2 weeks to flatten the curve, that 2 weeks, look what it's turned into. And so anything, if you do it on a graduated schedule, okay, instead of 2 weeks, it's the same thing. The analogy I use is in the ICU, someone gets admitted after a massive stroke and their brain's gone. And they say, okay, we're going to just put them on the vent for a few days. And then they say, oh, now they need a feeding tube. Now they need a breathing tube. Now they need this. Now you need artificial feeding. But it doesn't start that way. If at the beginning you say, hey, look, here's the path we're on, most families would say, not going to do it. Right. But when they say, well, let's give them a couple days, let's say, and then this is the same mindset. The patient was dying, but we weren't willing to say, this is what the ramifications of what's coming, I think.
Yeah. And then I guess it was the end of May when that was the last straw for me, when I realized there was more going on than any of us will probably know for a long time, because, my husband's Louisville Metro Police Department, and he's a homicide detective, so he's not on the beat, but he knew the officers that were involved in, we're not like good friends with them, but we know of the officers that were involved in the whole Breonna Taylor incident. And so we've always known kind of what that was about and what happened. Not saying that it's not tragic and that mistakes weren't made, but it was just, the narrative that came out in the media and then on social media was really not correct. And, it was to the point where people that I know, not, doctors that I know, were tweeting out or posting things on Facebook with an opinion on that whole situation, and they were getting it completely wrong. She was an EMT who, they were at the wrong house and they just like killed her in her bed. That's not what happened. So when I knew that the whole time, so when when the riots happened at the end of May, and then, my husband's called, he's a homicide detective. He's not even supposed to be called to these things, is called to bring his riot gear, at 12:30 at night to go to our city as it's being burned. And all of the experts are saying that's fine. It's fine for people to get together and protest or riot or whatever.
Mostly peaceful protests, burning down buildings and businesses that people sacrifice their lives to build, right?
Oh yeah. While my kids still weren't in school at that time, they were home on what they called NTI, non-traditional instruction. So it was all virtual school, so I'm a very logical person. So that scenario made no sense to me. And so never mind that, like, it's so painful to know a truth and to try to tell people that you love, family members, friends, no, this is the truth, and have them believe social media, have them believe CNN,
Yeah, it's a hard thing. It's a hard
they've
thing.
known their entire lives. That's hard. So I'm really glad that I had my faith during all that, because that was, really hard to get through. And
sometimes, and that's that speaks of faith too. And I think that's it's important when you see a truth and you want to share the truth, and it's hard because no one believes the truth anymore. And that's a really, trust me, that's, for you and I struggle with the same thing at the same time, because I was thinking there's information I had on PCR testing, and I was looking, I talked to some of the experts, world experts, and they go, this is all BS. It's all BS. Talk to enough people when you say, well, Ivor's saying that and all these other guys are saying the same thing, because it's true. And I had to look at my clinical experience and say, okay, look, how many people of mine in my practice died of COVID? Zero, not one, none, right? And that was luck of the draw, right? Maybe my patients are metabolically healthier because that's what I focus on. But it's hard when you say, well, does a positive test mean that you have COVID, that you're infecting everyone, that you're going to kill all your neighbors? It doesn't mean that. A positive test. Now we're changing all the criteria, but all the people who said that they questioned PCR testing were called deniers. They're conspiracy theorists and they're crazy. But it's like, we were seeing the truth, because when 80% of the people in a town next to me, they were tested positive for COVID, but never had symptoms, you think, well, heck, there's something wrong there. There's something wrong. We've never tested asymptomatic people for the flu. We've never tested asymptomatic people for all these other illnesses. You think, why would that be?
And we never have quarantined any asymptomatic.
Never happened.
It's just,
So it's a hard thing, because if you question, go, this doesn't make sense, guys, then you are kind of the crazy person and you lose credibility, even though you're right. And so it's one of those things in life, you realize, gosh darn it, like, how right do you want to be? But I think for me, it really, I had to look at my courage, and I had to look and say, okay, is it worth it? At some point you say, is it worth it, when you see people's rights being taken, and we're seeing the ramifications. No one was talking about, that in San Francisco, there's more people dying of overdoses than of COVID, right? No one talks about that. A loss of life is a loss of life to me. And so you say, okay, do we just worry about one cause of death? For me, I have to look at the entire patient. And in your area of medicine, addiction medicine, low carb, all these things, you realize, oh my gosh, there's ramifications. If the average person is gaining 20 pounds during COVID, then we got problems as a society, because that's what puts us most at risk of dying of COVID, right?
Yes, exactly. There's been so much hypocrisy with the Krispy Kreme offering donuts for the vaccine. It's been insane. It's almost parody, really. But no, you're right. Not only did overdoses increase in Kentucky this past year, when we were on a trajectory finally where things were improving, overdoses increased. We lost a family member to overdose. My cousin died in December from overdose, and he was waiting for. He had found, I guess, rehab to go into, because he was an attorney. So he was a professional, and he was waiting for his COVID test to come back so that he could go into rehab, and he died. So he was, I think, 34 years old, and he had been in recovery for years. Unfortunately, he was not on medication-assisted treatment. He had been well for a long time, and so I'm sure he thought he didn't need it. And he knew I prescribed it. I feel like if he wanted that, he would have found me. But it's just, his son was 3 months old when he died. So it's just really tragic. And I'm not the only person who has lost someone of something other than COVID. But also my brother was really sick with COVID. He was hospitalized. So, I'm not denying that it can be
I
very
think that's
serious.
the reality. Yeah, we realize that, and the
Yeah.
question is, was the reaction the appropriate reaction, right? Not that it
Yeah.
doesn't exist and that people didn't die, because I know people get upset, and I understand that. If you lost a family member to COVID,
Yeah.
no one's playing light of that. We understand that that's an issue for sure. I mean, we saw it, and none of us want to lose a patient or a family member for sure, and we
No.
understand the gravity of that. However,
Right.
I think you have to look at the science also and say, okay, what's my risk if I'm an 18-year-old kid of dying of COVID
Right.
that's
Very
healthy
low.
otherwise, and that's what we have to really, it's not a one size fits all. In medicine, we understand that, and I think those are the things. Is the reaction appropriate?
Yes. I know, I agree. And the other thing that's happened, we've seen homicides have gone up, suicides have gone up in Kentucky. So I got involved with the Job Creators Network back in April, and they were running a campaign called the Flatten the Fear campaign. Are you familiar with them, JCN? Job
Yes.
Creators Network? Yeah, because their whole reason for being is to help small businesses. And so, you're a small business owner, I'm a small business owner, and we were lucky because we're healthcare. So we really didn't, I don't know about you, but I really didn't struggle much with financially, thank goodness. And I continued to work. But many of my patients are restaurant owners or, work in fields that were kind of shut down and have really suffered. Many of my patients lost their jobs, and then some of them, for whatever reason, were able to get their unemployment checks, and others waited months to get their unemployment checks. So I had patients who were in danger. I felt like were in danger of relapsing because you know, they didn't have the money to pay me. And so I can think of 2 or 3 people that I said, you know what, we can work something out. I understand, like, this is hard times. And of course, everybody eventually paid me because that's what they want. They don't want their care for free. But, you know, I'm just blessed that I was able to work with them in that way. We couldn't do that if we were still in the system and there was coding and billing. You can't legally, first of all, your employer is not going to let you write off somebody's bill. And then secondly, you can't waive a copay or no charge, for example, a Medicaid or a Medicare patient, because it's considered fraud.
Exactly. Yeah, that's true. That's true. And so that's
Yeah.
when you move over to direct primary care. I think the thing that helped us during this, because trust me, across my mind, I think, okay, I'm leaving the insurance model where I have I'm taking a huge pay cut already. I realize that I have to buy equipment. I have to, start a business, get the name out, let people understand what I'm doing. And COVID hits at the same time. And so I'm thinking, I could be in big trouble. But really what happened was I could do telemedicine. I knew I could do that and not have to dealing with insurance and upcoding and all this crazy stuff. But also people knew if they came to see me, it'd be one-on-one and not be 30 people in the waiting room. And at that time, the frustrating thing for me, as you and I, as frontline doctors, when the guidelines came from our governing bodies, it said, don't treat people with COVID, send them to the ER. So I'm thinking, if they don't have COVID and I send them to the ER, they're going to be exposed to COVID, and I'm making my patient worse. And so many patients came to me during that time because they said, my doctor won't see me. They won't, you can't diagnose over a Zoom chat, right? So,
Right.
there was a lot of that where they said, just go get COVID testing before. So all these people who had a cold or sinus infection, whatever, strep throat, they weren't being treated appropriately.
Right.
And there was delay of treatment. And we know delay of treatment is not good in these conditions. So there was a lot of that. If someone had appendicitis, they go, you have a fever, go to the ER. So the ERs were flooded and jammed with people that we should have been seeing on the front lines.
Right.
And so that was a frustration too, when they said, wait till your patient turns blue. And it's like, is that my only option, guys?
I
Really?
know. I
And at
know.
the same
Well,
time, the frontline doctors were out there talking about this, and I had to weigh it, and I go, are these guys all crazy? And I knew 2 of them, and I said,
yeah.
are they crazy? Have they gone off their rockers? Why are they doing this?
Oh,
Do
no,
they have
no,
a
no.
vested interest?
I mean,
Right?
I am one. I was invited to go to DC. I couldn't go. My husband was swamped with homicides, and there were protests and riots all summer in Louisville. I have 2 kids, so there was no way I could go. And, to be honest, I'm glad I didn't go, because they were so attacked. And, I didn't need that on my family. I didn't need that when, my kids were already noticing their dad being attacked just because of what he does, so I'm glad I didn't go, but I still have been in contact with all of those doctors, and I do treat COVID. I kind of sat back and kind of watched the whole hydroxychloroquine ivermectin thing for a long time, and did not want to weigh in on it. The reason they invited me to DC was to talk about the secondary consequences. So to talk about the overdoses, and to talk about the relapse and mental health consequences that I was seeing. I wasn't really going to talk about hydroxychloroquine or ivermectin at that point, because I had no experience there. But in October, when my brother got sick, I reached out to Dr. McCullough, and he helped me get my brother started on treatment. Unfortunately, it was day 5 or 6 by the time so it didn't work well. I mean, I still think he's alive today because of Dr. McCullough's help. But he did end up being hospitalized. Now he had smoked for 40 years, and he was not metabolically healthy. And he was, quite frankly, very worried that he was going to get COVID. He was nervous about it all summer. And he followed all the guidelines, wore his mask. He worked the whole time because he was essential. And he got it from his family. His wife had it. She had no idea, because her symptoms were pretty mild. She thought she had allergies. So he got it from her, and he texted me one day and told me, this is the deal. I'm going to get a test, and I just have a fever for now. Well, his doctor wouldn't see him. I told him, please ask your doctor to put me on the HIPAA form so that I can communicate with her, just out of respect. They wouldn't let him do anything. They wouldn't bring the paperwork out to his car. They wouldn't let him into the office to fill out the paperwork. It was just insane. And, to this day, he says, I don't know that I would be alive if you weren't my sister, because I didn't know that I needed to be monitoring my oxygen saturations. And he's a tough guy. He's law enforcement as well. So he was going to wait until the absolute last minute to go.
Typical guy. Yeah.
To the
That's
hospital. Us. Yeah. And, but we were communicating over the phone, and I could tell that he was short of breath, and I was like, you need to go. So he went on a Sunday. They didn't admit him, even though they should have, because his oxygen was already dropping when he walked. And then he went back 2 days later because he was worse, and they did admit him that time. So, that woke me up. That was like, people need more help than this. This is terrible. This is abandonment. And that was when I got involved with starting to treat more people here at my practice. If they were high risk, if it was a 20-year-old who came in here and had a runny nose or something, then I didn't necessarily do anything other than vitamin D, zinc, vitamin C, trying to keep the carbs low, don't drink alcohol, that kind of advice. But if it was somebody, I had several patients that when I found out they had COVID, I was like, oh no, this is not good. Like, this person could die.
Well, and I think people didn't realize, a lot of people still don't realize, that there were studies retracted that were absolutely fraudulent, that we publish in our best journals, right? They're not called to the table for this. They just, oh, okay, it's not a real study. Like, how does that happen?
Well, the original press releases that go out on the study saying, oh, hydroxychloroquine doesn't work. The original one goes out, it gets tweeted 9 million times. And then the retraction, when they retract the study, that tweet, gets retweeted 1,000 times. So
and if you retweet it, you got pulled because it was false and misleading information. There was all that. I mean, really, honestly. And so that's a hard thing. You had to walk a tightrope and kind of monitor the situation and measure. And you darn well, for me, I darn well better know what I'm talking about if I open my big mouth on this stuff, because we also have a responsibility to say, look, I can't let people die if I know there's an alternative treatment that may work, right? It may or may not. But then I look and say, okay, if 20% of the people die from using the medication, then you don't do it. It's not worth the risk anymore, right? So it was one of those type of things we looked at and said, okay, let's assess the safety and the data. And we're seeing the data coming back now, live data from India, dropping the 97% decrease in hospitalizations within a week or two of using ivermectin. So you say, okay, is that just a coincidence? Is that so? All these things we have to really look at and say it takes time to do a randomized controlled trial. There's a lot of stuff that we haven't studied, and I think a lot of people just don't realize. And I would hold Dr. Fauci and some of these public health people responsible for not giving the whole story. We've never talked about natural immunity, which we all know works, right? If you've had the disease, there was just a study at Cleveland Clinic that showed no one had a recurrence of disease. So do those people not count? Those kind of things. As doctors, I have to weigh the risks and benefits. And the studies on vaccinations were not done on people who previously had the disease. They were excluded from the study. So you say, well, we don't know what's going to happen. So it is experimentation on human beings. And you have, that's just the honest truth. And you look and you go, wow, am I willing to take that risk on my patients? I don't think so.
Right. Yes. And the medicines that I've been prescribing for people, for my patients that I see here, they've worked for the most part for the people that were very high risk. I had one patient end up hospitalized. He was high risk and did not start the medication until day 5 or 6. But everybody that I got started early did fine. And I understand that's not a randomized trial. I took hydroxychloroquine.
But we hear that all the time from docs. And I think that's the thing is you say, okay, if this is as deadly as we think it is, I have to jump on, because the studies they did, the misleading studies were waiting until they were intubated, then put them on these medicines, which is like, once you have shingles, you don't start, once it's been there for 2 weeks, you don't start using the medicine. There's certain things where you start understanding. And some of these people like Dr. McCullough and Dr. Pierre Corey were coming out saying steroids work, this works, this is what we're seeing. And they blackballed them. They say, you're going to ruin the immune system. You're crazy. Well, it's an inflammatory problem. And so they're showing their benefits. But, seeing Dr. Pierre Corey's testimony really touched me, because I saw the anguish in his eyes and the fear of saying, look, guys, the desperation, I would say, of saying, look, it's working. Please let us do this. Please move this.
Those guys are heroes. Yeah. Well, the other thing that's always struck me, because I treat addiction and witnessed sort of the ravages of the opioid epidemic here in Kentucky, is that we prescribed opioids, like really high doses of opioids for pain for years with no evidence that they work for chronic pain, and
off-label use of medicines is done all the time.
That's just insane to me. And it led to the opioid epidemic. And then, of course, I'll admit, I got to a point where I felt like we should not be using these meds for chronic pain at all. And then God put me in a position to be on that, pain task force that met in DC to talk about best practices for pain. And I met so many people who take opioids, I hate to say the word response, that sounds judgmental, but who take opioids like they're prescribed for their chronic pain, and they do fine and they actually function well. So that was another example in my life where kind of, my thinking was getting extreme one way. And then God kind of pulled me back, like, well, wait a minute, there are people who can benefit from these medicines. And my role on the task force was always to say, hey, listen, we're identifying this problem, and maybe this is a different task force, but the real problem is there are too many bureaucrats involved in medicine. Like that's the real problem. That's the real issue in our country. You and I demonstrate that when you have a doctor-patient relationship, when you have time to sit with a person and talk to them about what's going on with them and help them make changes, that's medicine, and sometimes that involves using a medication that has been proven in randomized controlled trials. And sometimes that involves, hey, let's try this medicine because you can't take an antibiotic. So let's try this.
Yeah. And our job is to discuss the risks and benefits of every treatment. Right? That's our job.
Exactly.
It's to
Yeah.
understand, do the best of our knowledge, and say, okay, I'm going to leave my personal feelings out of it. Let me look at the data, and let me see. Say, hey, look, there's a chance these guys could all be crazy, and that hydroxychloroquine doesn't work, and that ivermectin doesn't work. But worst case, here's the worst case scenario. Here's the best case scenario, right? And then we have to weigh that with each patient, with regard to vaccination, with regard to any treatment we give, right? Low carb,
Right.
everything. We have to discuss
Right.
this and say, hey, look, are you willing to take this chance? So for me, am I willing to parachute? I haven't been parachuting before, skydiving. But if it's in good hands and I feel very comfortable, but if I don't trust the person, forget it. I'm not going skydiving. If you have a rickety plane and you got, we'll just pack this thing right now. And I want to make sure it's right before I do it. I'm very conservative that way. So when I was, as a doc, was sitting there with the prospects of having someone die in my hands because I'm afraid to treat them because I could lose my license, that is a horrible place to put a doctor when you're trusting Twitter's judgment over mine, right?
Right.
And
Well,
that's the problem.
and medicine changes, science changes. We've been wrong on many things. We used to give the medical establishment, we used to give women hormones as soon as they started to enter menopause, and then a big study came out showing, well, maybe we shouldn't do that for everyone. Maybe take other risks into consideration. Don't give estrogen to someone with a strong family history of breast cancer or uterine cancer. I think it's good to have these big studies and to have that information, but it's not the only thing that we can that we have in our toolbox to help people. And you and I, of course, we're going to be willing to think outside the box. Ivor's willing to think outside the box because we know that everybody's still being taught that you should eat 10 pieces of bread a day and that's healthy. And that's what our government thinks. And
just the training and the education you have, like you said, I have to be able to reassess and say, okay, I can't be too hardcore on this area. Say opiates, no one can have opiates ever again. Not every single person should be on opiates. We have to find what works for that person in front of us. And I think that's medicine. That when we talk about life's best medicine, my best medicine is saying, okay, I have this patient in front of me. If they hate meat, I'm not going to tell them to be carnivore. If they hate vegetables, I'm not going to tell them to be vegan, right? So I say, what works for you? If you can't give up cookies and that's your only reason for living, okay, what else can we give up? What can we do to make you healthier, right? I don't want to shoot you with insulin. I know the road that's on. So I think for all of us, the problem is, and I think this is the big thing we've been up as low carb docs, is there's a standard of care in medicine. The standard of care can be the worst thing in the world. The standard of care of throwing everyone on insulin is not the right standard of care. So every day I'm taking people off of medicines. Why? Because they don't need it, because they've made lifestyle choices, right? Yeah, exactly. And the other thing I would hold our public health people, I don't hear them talking about vitamin D replacement in our seniors. I don't hear them talking about zinc. I don't hear them talking about some of these studies, and at least weighing in the odds and saying, okay, guys, here's the risk benefits. Maybe it does help, maybe it doesn't, but what's the downside of taking vitamin D3, of getting out in the sun, of playing tennis, of enjoying yourself? And like you said, with the small businesses, when I saw the small businesses close down, but Home Depot's open in San Diego, the strip clubs were open and the bars were open and the casinos were open. Why? Because they fought them and said, this is against our civil rights. We're not closing down. So the churches didn't do that. People didn't do that. And so they got closed down. And when you talk about the importance of fellowship and community, that's really important. And stepping back one more time, I hate to be on a soapbox today, but I knew we'd kind of be on a soapbox. Being married to a police officer, the hatred that I saw, and it's shocking to me. Growing up as a kid, I was told to respect the police. Now, I don't agree with some things, obviously. I mean, we've seen terrible things, and I hold that individual responsible for that. But I don't extrapolate that to all police, as if I'm mugged by a Latino person, doesn't mean I hate all Latinos. That person who mugged me was a bad person, because every religion, everyone has bad people and everyone has good people. And I think until you step back and say, okay, let me not put this blanket judgment on everyone. Right.
Well, and one of the things that a lot of people don't know about me is before I went to med school, I think I would have been considered more left, more in my thinking, just working for the federal government, living in the Washington, D.C. area, being young, all of those things, and not. I don't mean politically. I actually believed in single payer healthcare at one point. Okay. I mean, I really did believe that. And I think we can study things in books, because I went to Johns Hopkins University and they believed in that. So if you know, as you can imagine, getting a master's in public health at Johns Hopkins University, health policy was the topic much of the time. They believed that single payer is the answer to all of our woes. So I bought into that. Then I went to med school. I rotated at the VA. At that time, that was when Chris became a police officer. So you know, I didn't really know that much about what it was like to be in a family of law enforcement. Even though my brother had been law enforcement, I just wasn't engaged in anything political or the news when I was a kid, when my brother was law enforcement. So once I was going through this change in my thinking during med school, based on working at the VA, seeing how bad that whole scene was. So I started to feel more passionately about single payer was not the option. And then meanwhile, Chris is becoming a police officer in Norfolk, Virginia. And I'm seeing things presented in the media about the police in Norfolk that aren't true, you know? So prior to that, prior to actually being married to someone in law enforcement, I would have believed what the media reported on all of these incidents. So it never really, I think that still goes on, and I think it's gotten worse. And I think if you don't know someone, if you're not connected to someone in law enforcement, either, you know, by family or friendship, you don't know. You just believe it. Because why would they lie? You know, what possible motive would the media have to paint that situation this way? And then, you know, of course, there are horrible things that happen with terrible tactics with George Floyd. You know, I've talked to my brother, who actually, he's an instructor in law enforcement, and Chris is an instructor now too. So we've talked about that whole thing, and it was horrible and egregious, but those incidents are rare. When the media focuses on them with a microscope and talks about it incessantly and makes it about race and makes it about bad cops, then it's amplified, you know? And so I think,
and then also what happens is, and this is what I was saying at the very beginning, is look, when you make these two groups hate each other, if you have the inner city youth afraid of the police, you have the police afraid of the inner city youth, now you got a problem on your hands, because everyone's going to be pulling for that gun very quickly, right? And that's what's happened. We exacerbated the violence by turning, instead of saying, hey, how do we come together as a community? How do we figure out, you know, police, you're singling out these guys, how do we fix this problem? Or, you know, how do we, you know, work on the drug problem, the gang problem, and the gang on gang violence, which is by far way more devastating when you look at the numbers, right? Yeah. These kind of things, it's a problem because we're not exposed, so people don't know. And I've talked to people on both sides to say, look, here's what my view is. I was like, well, is that the real numbers? And I think all those things, and I think that extrapolates over to everything we're talking about as far as COVID. The numbers are so different than what everyone's perception is, that if you get COVID, there's a 90% chance you're going to die, right? If you're over 80, it's a 94% survival rate, all comers. If you're under 50, it's like Ivor said, it's half the risk of dying of falling off a step ladder. Do we worry about step ladders all day? So I think when you take the fear out and say, okay, what are my odds and what are the numbers, you start thinking differently, I think.
Right. Exactly. And I'm thankful that my parents, they live here in LaGrange, Kentucky, about 5 miles from me. I'm thankful that they made the choice over the past year to see us still, and, you know, celebrate occasions. And we were careful, so if somebody was sick, I wouldn't have them over, you know. And in November, when I actually got COVID, my parents were out of town, thankfully, but I don't think they would have caught it from me, because the people that live in my house didn't catch it from me, you know. So I feel bad for people who kind of shut down their life over the last year over this, because I do feel, unfortunately, like there's something sinister going on, and that's not a conspiracy theory. That comes from a place of experience, knowing what the government is like, what bureaucracy is like, knowing what certain people involved in this are like, and how they have big egos and don't want to be wrong. Politicians who have big egos and don't want to be wrong. And then also from my position of faith, I do believe in evil. I mean, I believe that, some of this is evil. I would rather believe that it was just, I don't know,
Incompetence or poor judgment.
Incompetence or, basically I would rather believe that it's just incompetence and it was so new that we didn't know what we were doing. I would rather believe that. But I actually believe that there's a lot of evil in this and a lot of politics in this. I wonder if it would have been very different if it had not been an election year. I think everybody can agree that it probably would have been different. So I think that's unfortunate. And our kids really suffered the most because of humans being humans.
Well, yeah, and I think that's the problem is those of us of logic, you sit back and say, and I think a lot of people sat back and say, well, this doesn't make sense. When I walk into the restaurant, I have to wear a mask. When I sit down, I don't have to anymore. If I'm in the airport, I have to wear a mask and I have to social distance. When I'm on the plane, we all sit next to each other. We can take off our masks to eat. You go, well, if it was a poison gas, you would not be doing that. And
Right.
Also, if it was a poison gas, all the politicians wouldn't be going out to dinner with their friends while we're isolated. So you start seeing these things, you think, wow, this doesn't make sense. Because if I'm really fearful of something, I'm not taking any chances, right? And I'm very conservative in my saying, hey, I'm not going to take dumb risks that I don't need to take. Like I said from the beginning, I said, look, respect COVID, but don't fear it. Don't live in fear, but respect it and say, okay, I got to really take this serious, and I'm not going to do dumb stuff. I'm not going to go to, the dance club all night and with a bunch of people I don't know. But
Right.
I think one of those things in life, like you're saying, is there is definitely evil in the world. And for me, the thing that really brought it to a head, and the reason this podcast exists, besides God was bugging me for a year or two before I started it, because I kept putting it off, because I felt like I had a message, and I think it's important to talk about faith and hope. But when I talked about that on Twitter, I got lit up for 3 days, and all these people say, prove your faith, prove this. And I got attacked for saying, hey, there's going to be a better day. Now, guess what? There's a better day. I was right. There's not going to be this horrible thing. And when you take away hope from people, I think it's the most evil thing you can do. Right. From a dietary perspective, from a addiction perspective, from marriage perspective, and when you say marriage doesn't work, you don't need the dad, get rid of all the police. When you start realizing this, you realize we're on very dangerous territory, and someone has to speak up. Like, I don't know if you saw just yesterday, in Portland, the riot police all resigned on the same day. It's like, wow, they're in trouble. You're in trouble because
they're losing officers here too, and it's and the officers who are out there still, I mean, as you can imagine, they don't want to do proactive policing. They don't want to get involved in many things. We're up to, I think, 91 homicides in Louisville now. And usually most of the detectives will get maybe 2 or 3 a year assigned to them personally. And Chris just picked up his 7th case. So, and it's only July. So they can't solve these. They can't solve these murders. And that's happening in many cities throughout the country. So it's not just here. And
then there was a push to defund the police, and you say, well, heck, if you defund these guys, who do I want to call? I want the police to come when my house gets broken into or I'm in trouble. Right. I don't want to call a social worker to come help me. I want a police officer with a gun. That's who I want to help me, who's someone who's on my side.
And I actually went and got my concealed carry, and like I've never been a gun person. I'm just never really been interested. And whenever we've just played around and shot in the yard or whatever, I'm like, nah, I'm not interested, but I just felt like this is a crisis, and carjackings have gone up about 400% in Louisville. I don't live in Louisville. I live outside Louisville, thank goodness. And so, I don't really go there, but I think, it's just a crazy time. And I think people need to realize that, truth is so important. And I wish more people would come out and speak their truth. So many people are fearful of sharing their ideas, sharing their experiences. and their thoughts over the past year because of the reason that exactly what you said, the bullying that happened online. And I mean, if you think about it, like if this was a bioweapon, and I'm not saying it was, even if it was accidental, if it came from a bat, whatever, the response to it was almost a bioweapon, right? Because it was perfect. It isolated everyone. The only way we could communicate with each other was online. We all know, and it's been proven, that when you're interacting on social media and you're not face to face, people are going to say things that they would never say. They're going to be more hateful. They're going to appear angrier, more snarky. And I have to be careful with that because, I'll see people being snarky on Twitter or Facebook, and I'll kind of want to put out some snark.
I'm working on it. I'm trying to.
And Chris checks me on it too. It's funny. He's like, "Yeah, that doesn't sound."
That's why I'm married. My wife says, "Brian, if you see me post dumb stuff, is because my wife was like busy and couldn't be there to chaperone me for a minute." But but I think it's really important. It's hard. It's a hard thing because I'm telling you, from a doctor's perspective and as a human being perspective, I really do think back to Nazi Germany when the good people sat there and said nothing. So I think a lot of doctors who said, yeah, I believe, like when I had Ivor on, I took Heath, and I know his integrity and I know him as a person. I know he may be snarky and he may get into fights and like Tro will fight with people, but I know their character and their integrity. And so a lot of people private message me, go, oh, I 100% agree with you, but I'm not saying anything. I got so many of those messages, and I got other messages saying, hey, look, you're losing your credibility by having Ivor on. I'm like, really? Is he wrong? Right. No, but people don't like it. I'm like, what? It's because sometimes you got to take medicine you don't like too. And sometimes you got to, not have cookies when you want them. Someone has to speak the truth. And I think like what we're talking about is really an important thing, is saying, are you willing to speak the truth, even if it costs you? Because I sat back and I watched these doctors and I just thought to myself, I'm not saying anything, but I'm going to watch, because I'm not an infectious disease expert. I don't know COVID. I don't know these things, but I know human nature and I know the history of medicine. I know what we've always done. And when you act completely out of, when you lock down all the outside dining and you shut down these restaurants, and I know a lot of restaurant owners that I take care of, devastating for them. Oh. And then they said, okay, we're going to reopen again. They opened for a few days and then they shut them back down again. And they bought all this food and they spent, $10,000 redoing the outside, and that's all a loss for them. And all of a sudden you can't, based on what? Have some good evidence before you make change. Because you want me to have really good evidence before I prescribe a medicine that's potentially life-saving. How about having some evidence when you shut down your entire economy? So I think those kind of questions, no, everyone was afraid, because if you say something, then you're a denier and you're crazy. But it's hard, because what's right is right and what's wrong is wrong. And what do? Sit back and say nothing? Because I want to tell my grandkids, maybe I was wrong, but I stood up for something. Right.
And I think that's what we're lacking from some of the people that have been in charge of the response. It's clear that they made mistakes. It's clear that they were wrong, but nobody wants to say it, and I'm not just talking about Fauci. There were other people. It's clear Kentucky did not need to completely shut down last April for 3 months, because we didn't even have COVID here yet.
Yeah.
I mean, we really didn't even get it
until
September. There were sporadic cases. Hospitals were empty, but our governor's never going to say he made a mistake. The doctor who advised the governor is never going to say they made a mistake, even though I think something like 71% of kids in Jefferson County didn't pass school the last year. They were out the entire year. They just went back in April. So I just wish more people would say, let's admit mistakes were made. Let's make sure that we do better next time. Maybe we ask other people to give their opinions, people that haven't been in the government for 50 years. Maybe some doctors who are actually treating COVID on the front lines, the
frontline doctors who are treating COVID got
some economists. And I don't know.
Yeah. And that's a huge, exactly. And that's a huge problem, because these guys are seeing it. And it's because what I was really doing is I was assessing my experience in low carb. I'm seeing people come off insulin. I'm seeing people getting better. I'm seeing their life get better. I'm seeing them, their knees don't hurt anymore. All these crazy things, depression, anxiety, stress, all this crazy stuff, but it's not the standard of care yet. Right. So my job is to say, okay, let's change the standard of care to make it so we're helping people, not because that's what we've always done, because what we're doing is a total disaster when we have 88% of the population on the road to diabetes, right? So when you start seeing that, we have a responsibility, whether it's popular or not, whether the establishment likes it or not. But I think the response of this COVID is going to say, let's listen to the frontline docs. Let's give them a little bit more respect. And when you see people like Dr. Unwin, who changed everything he was doing, he starts saving lives, and he gets attacked, and he's the nicest person on earth. So you start seeing these things like, okay, I could take a few arrows here and there, but I think standing up for something right, I think that's life's best medicine, saying, hey, here's what I believe. I may be wrong, but I'll stand up for this, right? And for me, I'll tell you, I'm a little bit ashamed that I waited so long to speak out, because I was watching and observing, and you darn well better be right. If you're going against the establishment, you darn well better be right. I'm going to make sure I use the right word.
But we're lucky because we kind of can speak out, because we're self-employed. We don't work for a hospital system that's going to try to muzzle us. And, I know the board could come after me, I guess, if they wanted to, but I don't think they would have a case. And I also have worked with them before on other things. So,
I think that's the important thing. Is I'm going to put my desk down and be lazy for a few minutes here, but I think it's really the case of saying, hey, let me do the right thing, and that's what Professor Noakes, he could have walked away, but he said, is working. I'm gonna do this. And Gary Fettke, people I respect, because I know they took a loss. They went through 3 years of hell, but they were right. They got exonerated in the end. So I think there's people like Pierre Corey. I trust him. I've seen his data. I've seen what he's doing. And Dr. McCullough, all these people, they have nothing to win. They're not pushing a drug, and they don't have investments, as far as I know, in these drugs. So I think
they've lost things.
And they lost things. And I think with everything, but they didn't lose their integrity, right? And I think sometimes you say, is my integrity worth more than being popular? Probably. I think so. For me, it is.
It is. Yeah.
And there'll be people who are upset about us talking about it, but it's truth to us. We may be wrong ultimately when we look back and they go, no, lockdowns really helped society and everything turned out great. I don't think so, based on what I'm seeing. So I have to judge it on my past experience and what I know about community, sense of community, loving people, being kind to people. And when you're separated, if you're, I think one of the most sad things I've heard is one of my patients is she owns a nursing home for seniors, and she was saying how many people died, and I said, of COVID, and she said, no, COVID related stuff. And I, but what do you mean? Loneliness, depression, isolation. They couldn't see their family, and they just gave up on life and died. They stopped eating. They just lost their will, especially if you're demented and no one sees you for a year.
So cruel.
It's cruel. Like, we want to do that to our worst criminals. And so I think, looking at society, this is an awakening call. And I think those of us of faith say, okay, I lean on my faith. I leaned on my faith a lot in the last year, leaving my practice, coming here, doing all this stuff. And I think it's a hard thing when people that don't have faith really say that's not the right way for you. It works for me. I may be wrong, but it works for me.
Well, I was listening to, I'm trying to remember, it might've been, I was the Megyn Kelly podcast, which is really good, or Barry Weiss is another really good one. Someone was talking about people just want meaning in their lives. And many of us get that from our faith. And part of the problem with social media and these tribes that you see on social media is a lot of people they'll go there looking for their meaning. So their meaning comes from attacking people they don't agree with, or joining getting someone canceled, or, it's sad, but I think humans really do want that. We want meaning. And I'm so thankful for my faith, because for the longest time when I was a teenager, I had some struggles, and I tell my kids all the time, listen, I know you're going to want to rebel against your faith, because it's kind of a normal part of adolescence.
Yeah, absolutely.
But if you listen to nothing else I say, just trust me that you need Jesus, to get through hard times. I just wish that I had been more faithful, more prayerful when I was younger, but I'm really thankful now. And I'm so glad that I met you, Brian, and the low carb community. That whole thing was another God thing too. It was just kind of plopped in my lap by a friend of mine who had completely changed his diet. And so I started to look into it.
Yeah, I think we all did. I think, you cross paths for a reason. I think, you had an influence on me starting this practice, and, it's being able to say, look, I did it, you can do it, and so, of course I make mistakes and do dumb stuff, but you learn from your mistakes and you move forward. You got to move forward. And I think in life, that's what we need. And I think really, speaking of faith and all these things, really for me, my faith grew stronger when I was challenged in my faith. I want people to challenge me and go, why do you believe this? Here's why I believe it. Right. I had to think about it and go, why do I believe that? Right. Not just because you believe it because someone told you that. And I think for your kids too, and my kids too, I said, well, like my oldest was challenging her beliefs. And I said, my wife was concerned. I go, that's good. Let her, because you need to challenge and you need to know what you believe. You can't just believe it because dad believes it or mom believes it or, your pastor says this. Look at it. That's how cults happen. Right. Because we don't question, we just follow. And that talking about cults, this is what happened. People said this was, 2.2 million people are going to die. It wasn't true. They were wrong, but they're not called on the table for that. Right. So I think when you see that and you go, we still believe that based on what they said a year and a half ago, that was based on terrible studies. And we know that. And so when you see that and you say, what's truth? Right. And I think that's really important that we question, because for me, I want to say really what I wanted was when those doctors stood up, I wanted them to be able to debate people and say, here's why we're saying this. Why do you say it's not good? And let us listen, and then we decide. Just like anything, if I think low carb's the best, listen to me and challenge me and look at it and try another approach. And if it works, because I've seen exceptions to the rule everywhere. And almost every rule I know of, there's an exception to the rule. And I go, okay, I got to weigh that and understand rather than discount it. Say, why am I seeing that? Right. And so I think that is a big problem. And I was thinking about it yesterday. I know we're running over a little bit, but I love talking to you. I was thinking about it yesterday. Universities are mandating vaccination for their kids coming in, and you look at the risk and benefit of that, and you think, oh, what's the risk of this kid dying, and what's the risk of them having a complication of the vaccination? That's what I have to weigh as a doctor, because that patient in front of me is what matters, right? I don't look at whole societies. I'm looking at that patient in front of me and what's best for that patient. And so when you look at that and you say, okay, you're coming to my university, I trusted you enough to come here, but I'm not going to give you a judgment call on this. We're going to decide for you. And I think that's what they're doing with our education with kids too, is saying, we're going to decide what you're going to believe, and we're going to decide what your faith is, and we're going to decide what this is. And I think the danger of that is so powerful, because we have impressionable kids that leave one way and they come back a different way. And they, like you said, you're in that environment and everyone says this is normal. And then what's good and what's bad, and who's the fact checker on these things, right? Who's the fact checker to say, is Christianity correct or not? Right? If you put me in charge of it, I'll give you one answer. An atheist may give a different answer. So do I say one of us is wrong and we can't be heard? Or do we say, let's weigh both sides and see what works for me? I know what works for me. And so I think as adults, we have to be able to say, okay, even if it's bad stuff I don't want to hear about, like police shootings, I need to look at both sides and try to understand and say, okay, was this justified or not? Was I the one? And I try not to judge people, because if I'm a police officer in a dark alley and someone pulls out something shiny, I'm going to shoot them probably to save my life. It may be the wrong decision, but you have a second to make a decision. I think that's why I try not to rush to judgment. Now, what's different than that is when I look at my public health officials and I say, well, how come you haven't reassessed what you're saying? How come you haven't even discussed natural immunity? How come you haven't discussed hydroxychloroquine?
That is bizarre.
It's bizarre to me that you don't reassess and go, yeah, in the heat of the moment, we didn't know, but now we've had time to think about it. We're going to look at all the data. When you say there's no data for something, when there's a ton of data and a ton of studies that I've read, it's like, how is that? So,
and people are getting really sick with this vaccine. I mean, I've never in my life seen somebody get a vaccine and have 3 days of fever and not be able to get out of bed. And I know a lot of people who did fine with it, had nothing.
That's the point. I've seen people do fine. I've seen people have devastating effects. And I think one of my ex-patients passed away from it. That's what my feeling. I can't prove that. I don't know, because they declined an autopsy, but a healthy as a horse person that's, young, healthy, fit, organic eating, no heart disease, just drops dead one day, 8 days after a vaccination, you have to question it.
Oh, it's happening. And I'm so pro-vax. I even gave the, cervical cancer vaccine to my boys, so.
Yeah. And I think that's an important thing, is say, hey, look, let me reassess and let me look at the data. And I think over time, this podcast either comes back to bite you or it doesn't. And I think you look and you go, okay, what am I, is it right to question things? Absolutely.
I'm not getting it. I know I have the antibodies. Why would I get it? But I guarantee if I worked for a hospital system, they would be pressuring me to get it at this point.
Everywhere. And I think it's there's a lot of aspects, and I have to take all those into account when I'm advising a patient. I think, and I said this a while back, my hardest consult now is people say, should I get vaccinated for COVID? And it's a hard thing. Have you had COVID before or not? How do we know? How do we not know? Are we doing these testing? Are you properly consented? there's social ramifications. If you want to travel, you want to go to a baseball game, is that important to you? If it is, then you look at that
Right.
aspect. You look
And
at
how
how
do
many
we
people you're
even
exposed to,
consent
all these
them?
things.
I mean, like you said, how do we even help them with their informed consent when it's so new and so fresh? It's a challenge. And I have given a couple of exemptions to some kids that I know already had it, and their university still wants them to get the vaccine. I'm comfortable doing that. I believe that they already have immunity, and even if they didn't, that they would probably be fine if
It's
they
not
got
even
it.
our belief, is what the Cleveland Clinic data showed, is what data shows is
Right.
zero chance, not zero chance, but in their study, zero recurrences. So you go, okay, does that work or not? That works. Do people who had the vaccination get sick? Yes. Are there people hospitalized after the vaccination? Yes.
Right.
From COVID. So you, okay, is it 100%? No, it's not 100%. So you have to look at these, you have to step back and go, okay, does it keep me from, again, you have to look at the science and not what someone's opinion is. And that's the hard thing, is really trying to advise someone. And you're right. We don't know the long-term ramifications. There's a lot of talk about it, but we don't know. I mean, it could be fine. It could be that there's major issues. And I think,
Yeah.
you know, for me, you know, you really have to weigh those things. And so I know we ran over. Everyone, hey, thanks for listening. And I want to ask you like a couple of things. How do people track you down if they want to talk to you more? And you know, if they're struggling with addiction, and also what's Life's Best Medicine for you? Well,
I did actually restart my Twitter account. I had quit back in January because I felt like it was affecting my mental health negatively.
It does.
So at Unbridled MD, and then my business name is Bluegrass Family Wellness. So you can find all of my information at bluegrassfamilywellness.com. And I just, before we sign off, I do want to mention we did start a new program, a new app recently called Foundations in Health, and it's you get a health coach, and it helps you change your nutrition and your exercise patterns. You also get some help with sleep and stress management. So it's a great way for people who have been worried about COVID, and maybe they needed to be because their metabolic health wasn't great. Now you can join Foundations in Health. You can get your metabolic health in check so that, you know, if we have another pandemic, or, you know, it'll help you no matter what. It will help you to do better with even the common cold and the flu, because those things are definitely not going away. You don't have to be a member of my practice to do it. And, you know, I hope you'll check it out.
It's awesome. And I'm copying you. I'm doing the same thing. And I'm really excited. It's a huge tool, because our time is limited and we have to help as many people as we can. And we know the truth on these things of metabolic health and how critical. So that's awesome. So for you, what's Life's Best Medicine?
Oh boy. Family and Jesus. It's a tie, but well, I have to put Jesus first. I'm sorry, Jesus, and then family.
Yeah, you know, I'd say the same. I think those are the important things. I think everyone, you know, love yourself, love your family, you know, love God, you know, reach out to find meaning, and allow your meaning to be positive. Like, you know, like Molly's saying, is like, a lot of people just reach out to be negative and cause hatred. And that's why Twitter is dangerous for people too. It's like, you're going to attack everyone. We'll get attacked for this podcast. I get it. I'm not going to have a sponsor on this one. It's just me paying for this one, because it's really important, because I don't want to be controversial, but, you know, we have to speak the truth. I mean, if the truth is controversial, then so be it. You know, it's okay.
Yeah.
But I
I'll
think,
help you out. Oh, I sent you some wine. Never mind.
yeah, I got that. That's an awesome deal. But no, hey, thank you for your support and what you're doing. And I love what you're doing. I think, you know, more doctors have to just, you know, speak truth. And you're right. A lot of people are just handcuffed and they can't really say what they're seeing and thinking. And I've talked to a lot of pharmacists who've said the same thing. They go, hey, look, I'm looking at the data too, and I see. And so it's hard. It's a hard time. And I think, you know, it's hard for me, for some people, not to really dislike them and judge. And so I'm working on that part of it, you know, because when people are hurt, we take it serious. And our faith it's not, you know, Jesus flipped over a couple of tables too. So I think it's one of those things you say, okay, I'm gonna live by faith and try to be a light, but sometimes you have to call out evil when you see it, or
hypocrisy,
injustice and all. And hypocrisy, I think hypocrisy is that, like, what we've been tagged with as a religion. I think we deserve some of that for sure. But the hypocrisy is blinding right now. And I think that's true. It's like, hey, if I'm out to help my patient, my responsibility is to that patient in front of me. let me research, let me do what I can to help that person. And it may not be popular and their mom may not like what my advice is, or their grandma or her cousin or whatever. But I think it's saying, hey, look, weigh the evidence. And ultimately what I found is most of the time when I got the most attacked is when I was the most correct. Right.
Yes.
I'll take it.
Yeah.
It's okay. I can stand it for a little while now. And with low carb, I think we're correct. And I think with a lot of the lifestyle stuff, we're correct.
We're
Getting enough
correct.
sleep and not hating the world and being positive and relying on faith in hard times. I think that is good medicine. So
Yeah.
Molly, thank you so much.
Thanks, Brian. Yeah,
And
hopefully I'll see you at a meeting this year.
we will. We will.
Okay.
We'll see you. And then and everyone, hey, be kind to yourself, be kind to others. Thanks for listening. I know we talked about a lot of tough topics, but it's important. Yeah, we're not trying to steer you one way or another. We're not giving medical advice here. We're just saying, hey, just sit back and think about stuff, weigh it, trust your judgment, trust your instincts, trust what you're seeing, and the stuff that you say, hey, this seems kind of weird. Then you pay attention to that. Maybe it's God telling you something. So have a great week. Thank you for listening.
You too.
Hey, everyone. I wanted to let you know about an upcoming conference that really had a huge impact on me, that's helped me on my journey and helped me to really understand metabolic health and what we're doing to make people healthier. And so I have my friend Doug Reynolds, who's the boss, who's putting on this conference. So Doug, tell us about the conferences coming up, Low Carb USA, San Diego. I love it because it's right next to my house and I get to sleep in my own bed and come, but maybe I get to stay in a hotel this time. I don't know. And I get to speak. So man, it's awesome that we get to all meet up together and build community. We all know how important that is. So Doug, welcome. Tell people about what you're doing.
Yeah, I mean, thanks, Brian. It's really exciting to be able to do it in person again. I think there's so many people out there that are just clamoring to be able to talk to people again and give someone a hug and just collaborate like has become so predominant in all the other events that we've done before this COVID thing hit. One of the things that's come up since when COVID hit, we couldn't do it. So then we flipped over and did virtual versions of the San Diego event and the Boca one. And we had a lot of people actually sign up and become a part of that. And so what it has done for us now is make us understand that the live stream component can be very effective for people that can't make it to the event. So this is a proper live event, and I think I want to make this very clear to people that I think they think it's like that. So many people have asked how many of the talks are going to be virtual and how many are going to be in person, and the answer is every single one is going to be in person. So we will have a live stream component. People will be able to access it via live stream, but all the speakers will be there in person. Anybody that hasn't been able to make it obviously just hasn't made it into the lineup. And I think that's really important, and it's really exciting that we've got all of these people coming out, and some really good names. Gary Taubes has been a stalwart with us. He's like always supported us. The first guy to say, let's do this. You obviously, Rob Sivers, Tro, Tony Hampton, Brett Scher, Dr. Ben, Amy Berger, Diana Rogers. I'm really excited that she's, on the sustainability side. I'm really excited that she's able to make it this time. We've been trying to get her to an event of ours for a while. And this is the first time. Andrea Salcido is a really, really amazing. She did one of the Grand Rounds talks for our SMHP. And she's a gynecologist. We've had a lot of comments from people from the feedback forms and stuff saying that you should get a gynecologist in. So now we have, Michelle Hearn was a potentially Olympic athlete who just like crashed and burned on carbs. And she's a dietitian, and she found keto and eventually basically carnivore. And it's cured her to the extent where she's training for the Olympics again. But she wrote this book called Dietitian's Dilemma, because everything that she'd learned as a dietitian she wasn't doing anymore in order to make herself healthy again. And so it's really cool to have a real dietitian's perspective of the problems that they have. She's basically left that vocation because she just couldn't function in the hospital environment, and that where she was not allowed to speak to people about low carb. And so that's a fascinating story. Dr. Gurpreet Pada, I think you might have even had him on.
Yeah, he's doing amazing stuff with pain
Yeah,
management.
he's just
and
one of the
building
most incredible people.
Yeah,
It's
amazing.
Marco Cazella is, I don't think,
He's a
anybody
legend.
at least in this one.
Yeah, he's a legend. I
Yeah.
worked with him in deprescribing the textbook chapter, and he's phenomenal. And he's struggled with metabolic disease, even though he's a long distance runner, and he was able to get soda out of the hospitals he's affiliated with, and that's a huge task.
Yeah,
that's a huge money maker. So yeah, so many great people, and I think the big thing is just being able to sit down. I know. For me, being at Low Carb USA, the first time I was able to sit down and have a cup of coffee with some great leaders that were just there, and they just are there to talk. And so there's so much great information. Anyone else we need to talk about, Doug?
Well, Steve Finney is the latest addition to the lineup. I've been chatting with him for a while now, managed to get him on board. Dave Feldman as well. He wasn't sure if he was going to be able to talk because of this research that he's got going on, that he might not have been able to actually speak in public. Arthur Agatston, I think, is going to be fascinating. I did a podcast interview with him the other day. I didn't even know until very recently, but he's the guy that discovered or defined the calcium score. It's actually known as
his name.
Yeah.
And the South Beach diet. He's done so much work. I mean, he's always trying to make people healthy. He's doing a lot. Yeah. So yeah, it's just great the amount of talent you pulled in.
And we've got amazing. The whole, for those people that know about the SMHP, which is kind of the other hat that I put on, the other organization that I run, that nonprofit, pretty much the entire board of directors for that is going to be at this event, either speaking or at least present. And then, the other committees, we've got the panel of advisors for the clinical guidelines. You're on that panel. It's just, there are so many, it's just going to be so many fascinating conversations that are going to go on over that weekend. I can't wait.
Yeah, and it's just, and you're also bringing a lot of vendors, like Keto Mojo is always there, and a lot of good people. Yeah. And so try different products, and there's some great Restore program who's doing some great work through your program and really getting it out to the masses. There's so many great people coming out, so I would highly recommend it. And I worked out a deal with Doug because I want people that, sometimes finance is a issue for people. So I said, Doug, look, my people need a discount, our people need a discount, so what do you work out for us, Doug?
So yeah, we've got it. If you use the code low carb MD, it gives you 20% off and it's not just the ticket. For those people that sign up for the dinners, for those people that require a CME certificate, whatever they add, whatever their purchase is, the total amount, that 20% comes off that total. In the past, when we gave discounts, it came just off the ticket price. But it's not that great a guy. It's actually just that it's easier for me to manage. To take it off the total, but yeah, as a result, everyone else scores, right? So
that helps too. And then, is that for people who come in person and online also?
Correct. Yeah. Right. So whatever is in your cart, basically, that discount comes off the total. And the other thing is, one of the options in the upgrade option. So if you only buy the ticket now, you can upgrade and buy the VIP dinners later if you want to join us. Or you can, if you signed up for the live stream and you wanted to upgrade to in person, because now you realize, hey, everybody's traveling and actually I think I can do this. Then you can still use that code on your upgrade options as well. So you can still get 20% off. If you decide later. So if you buy the live stream and later, in beginning of August, you decide you want to actually come in person, you can utilize that code again then for the upgrades, and they will apply, which doesn't happen for anybody else. So. And
what are the dates?
26th to 29th of August.
Awesome. And it'll be live. And if you want to stay in your hotel, I think, can you live stream it from your computer wherever you're at?
Yeah, so that's the thing, is it didn't used to be like that either, but I think every time we do this, we improve it. So now somebody that's in person has access to the live stream as well. So if they want to watch part of it, you know, in their room or something, they can. We would really prefer that they come down and you know, sit in the audience. But if for some reason that's not possible, they can watch it, or they miss something, they can go and watch. They can go back and watch that evening or something. They can, you know, watch a talk that they missed or something like that. And then they get access. They get access to those recordings after the event, and then within about 2 weeks, we normally are able to get all the individual videos of the talks populated on that site as well, and they have access to that forever. So
yeah, it's great education. I think being able to, because even being there, I've had times where I want to interview someone or just spend time with someone because they're coming from South Africa or something, and I miss a talk, and I was like, oh shoot, I want to see that one. And so it really does free you up to say, okay, I'll hybrid. You can sit and go down. You can talk to people. You can, you know, watch it later that night or on the weekend, because a lot of us are really busy. So that is outstanding. I'm really glad. That's a huge improvement for sure. And you know, and some of those talks you're going to want to watch it a couple of times to make sure you absorb it all, so you don't have to feel like you have to take notes. And Doug hates people taking pictures in the meetings because it's distracting, you know, for people behind them. So you'll have access to the talk, the PowerPoints and all that kind of stuff. So I think that's really huge. So hey, everyone, thank you. I think this is a huge thing. The reason I had Doug on, we have no financial interests. You know, it's really just because I know the benefit of this and how it can help people trying to live a better life and getting on track. And I know it helped me immensely and changed the course of my life, really. So Doug, thanks for all you're doing and continue to do, and you're making a massive impact. So Low Carb USA San Diego, I would highly recommend everyone come out.
Appreciate that, Brian, and thank you for what you're doing. I mean, it all started at one of our meetings many years ago, but I'm so glad that you made it to that meeting, because you're doing great things now too. Thank you.
Hey, I get some good South African food out of it sometimes, so it's all good. So hey, everyone, hey, thank you for listening, and thank you for your continued support. Welcome to the Life's Best Medicine podcast, where we are finding hope and healing one episode at a time. No appointment needed, no rubber gloves, and no coping. Just a healthy dose of life lessons to help equip you for this wild journey we call life.